Hi everyone, and welcome to this evening's presentation on depression and care partner burnout. With me is Dr. Hannah Cherniawsky and Patricia too. Dr. Cherniawsky is going to take us through some information and speak on care partner burnout. She is the current leader of the Health Savvy Seniors Initiative, which aims to educate and empower seniors to be an active member in their healthcare team. We will then have Patricia too, a second-year medical student from the University of Alberta, to speak on depression. Patricia is new to the initiative, but is excited to be a community advocate for seniors. If at any time this evening you're having any technical difficulties, you can in the chat box located on the lower right-hand corner of the screen and send that in. And my colleague Christine will be able to assist you with any technical difficulties. So with no further ado, I will pass this over to Dr. Cherniawsky.
Thank you so much. So as was mentioned, my name is Dr. Hannah Cherniawsky. I'm a medicine resident physician at the University of Alberta, and I'm going to be chatting with everyone who's tuned in tonight about care partner burnout. All right, I think we'll start off first with just a couple of definitions. So first off, what is a care partner? So a care partner is somebody who cares for another person who's living with an illness, a disability, an age, or anything else that may impact their living situation. So more than a quarter of adults in Canada are care partners for another. And the most common reason is aging, but other common conditions that lead individuals to be care partners is dementia, cancer, or heart disease. All right, so what is care partner burnout? So care partner burnout is it's a feeling of exhaustion. It's not just necessarily physical exhaustion from being tired from a day's work, caring for a loved one or a friend or colleague. It's also an emotional exhaustion and a mental exhaustion. It's something that's not necessarily remediated by just having a nap or getting a good night's sleep, but it's something that you can feel at a much deeper level, this exhaustion. It's also a change in attitude. So people who are experiencing care partner burnout can sometimes have a shift in their thinking from a positive perspective to a negative perspective, or from even to a position of apathy. So people can sometimes express that they just don't care in the same way that they did before, not in a way with a malicious intent or a hurtful intent, but that it's just difficult to have that motivation to care and have the positive attitude like they did before. So let's start with an example. So we'll start with Marvin. So he's the primary care provider for his wife, Julia. So Julia is living with dementia, and she requires more and more help for her self-care. Marvin used to enjoy coffee time with Julia, but now he finds that the changes in her memory are quite frustrating to him. Marvin finds that he's feeling unusually sad, and he seems to be distancing himself from his friends and his family. He even missed paying bills and missed his own medical appointments because he just can't find himself to drive there. It's just too exhausting. He finds that he's having some feelings that it might be easier if Julia were in a care home, and he finds this very resentful of his role as her care partner, though he still finds he loves her very much. So this is an example of care partner burnout. Just to go back to the example before we move on, we can see in Marvin these feelings of exhaustion. It's something very deeply ingrained in how he's feeling, as well as change in his attitude. Although he has this deep love for his wife, he's feeling like he just doesn't have any motivation or just doesn't care to go to his own appointments, and is having some negative feelings towards the relationship. So what are the risks of burnout to the care partners themselves? So this would be Marvin in our example. So there's a risk of the care partners developing mental illness, such as depression, anxiety, or even issues with substance abuse. There's also a physical illness from providing care and potentially neglecting your own self-care. Additionally, there's financial strain due to the expense of providing care for a loved one, and perhaps having to not work as frequently or use finances that may have been meant for other uses in the care of a loved one. And there's also a risk of relationship strain and isolation to the care partners. However, there's not just risks to care partners, there's also a risk of dependence on those who depend on care partners to provide their care. There's a risk that those individuals' care needs might not be met, and it might put the individual who requires this care at risk. Additionally, there's a risk of isolation. If a care partner is feeling that they have very limited motivation to go out and seek engagement with others, it can be very difficult for them to do so for the dependent that they're providing care for. Additionally, there's a risk of relationship strain. So just as Marvin was feeling this strain on his relationship with Julia, Julia may also be feeling that as well as a result of this burnout he is experiencing. Additionally, there's psychological consequences. So as I alluded to, from a straining relationship, this can be internalized by those who are dependent on care from their care partner and result in further strain on the relationship and isolation between the two individuals. So what are some key points? We've talked a lot about care partner burnout. What is it? What does it put care partners and their loved ones at risk for? But what are some key take-home messages for those listening at home? So the key point we really want to emphasize is that you're not alone. Care partner burnout is very common. However, the most important part is recognizing it. Recognizing it not only in yourself, but also in those around you who might be at risk. And also understanding that by early recognition, we can take steps to put supports in place and address this issue to prevent further harm to the care partner or the one they're caring for. And additionally, we really want to emphasize that supports are available in the community to help individuals from preventing or those who are suffering from care partner burnout. So the first is the Alzheimer's Association of Alberta and North Territories, which we're so grateful are hosting us today. So their website is listed above, as is their contact information, including phone number and their email contact information. So the Alzheimer's Association of Alberta and Northwest Territories is able to provide information about safe living, communicating and caring for your loved one, as well as contact information to get you in touch with local support groups and local organizations that may be able to assist you. Another great resource is Community Care Access. So the website is listed here, and there's a 24/7 number listed on this slide there. So this is essentially the organization that provides home care within Alberta. So this number is a self-referral. You do not need to see a physician or a nurse or anybody to contact this number. If you are feeling that you need supports at home and that would be something beneficial to your success as a care partner or for those you're caring for, or being successful in living at home in general, this is a great number to contact. They have information about supportive living, about day programs, and even palliative care. So it's not just about home care resources, but that's certainly a large part of what they do. So additionally, Caregivers of Alberta is another organization. Their website and their information is, and their phone and email address is listed there. They have in-person advisors that are able to advise you about providing care for loved ones, and even provide some courses at a small fee that care partners can attend to teach them about navigating the system and resources that are available in the community. So lastly, the Alzheimer's Association is an American organization. However, I wanted to bring this one up just because they have a 24/7 helpline. So if you are ever in a time of crisis, caring for a loved one, this would be some place that you could turn to contact. It is mainly focused on individuals who are living with Alzheimer's. However, they do have helpful information on their website for care partners in general, and is, as I said, the 24-hour helpline is a good resource if you ever find yourself in need. All right. Lastly, the websites listed are all available here on this slide for any further information if you'd like to visit those websites.
Well, thank you, Dr. Cherniawsky. I'm going to open it up for any questions. So anyone who's logged in, if you have any questions, you can absolutely type them in now, and we will wait for some to come in. Thank you for sharing that information. I know just a question that pops into my mind, how would I recognize if I'm just tired, like just from day-to-day life versus kind of a burnout?
That's a great question. So I think that the key to identifying that is two things. One is tiredness that just won't go away. So for instance, often if feeling very tired on the weekend, we might try to invest some time in ourselves to catch up on sleep. But if that is just not working, it's just not enough, it might be a sign that you're suffering from care partner burnout. Additionally, an important thing to be mindful of if you're feeling that way is what is your attitude? So that goes back to that second piece of the definition of care partner burnout, and that really involves an attitude shift in the care partner from positive to negative. So if this feeling of fatigue and tiredness is also associated with you not caring as much about things that you used to be very invested in, or having a negative attitude to things that used to bring you joy, those would be signs that you may be suffering from or at risk of care partner burnout.
I'm just going to see if we've got any questions coming in for Dr. Cherniawsky. And we will, if questions come up, as we will go into our next presentation on depression. So if any questions do come up that throughout our webinar, we will take some time at the end of Patricia Tu's presentation to answer any questions that maybe came up in the meantime. We are going to switch it over to Patricia to talk more about depression and how that impacts care partners. So I want to welcome Patricia, and I will hand over to her to talk about depression. So Patricia, take it away.
Thank you so much. Hi everybody, my name is Patricia, and just to repeat, I'm a second-year medical student, and I'm going to be talking today about mood changes and mental health. Okay. So first thing, what is depression? So sometimes people may think that feeling sad or lonely is just a normal part of aging, but it's really not. So depression is an actual brain disease. It's not the same thing as normal sadness, which can be brought on by just life events itself, and depression can really affect the things that you do every day in your life. So if you feel, or someone you think is feeling sad, hopeless, or bored with the things that you would normally enjoy, lasting for weeks or months, you may be experiencing depression. So how do you know if I'm depressed? So have you noticed that you may no longer enjoy or care about doing things that you used to like to do? Or have you been feeling sad, down, hopeless, or cranky most of the day, almost every day? So depression can make you have mental changes as well, so the change in mood, but it can also result in physical changes, changes in your body and what you're able to do. So you can have changes in your appetite or weight, including increased appetite or decreased appetite, and both weight gain and weight loss. You can sleep too much or too little. You may feel like you are constantly tired and have no energy, and you may also feel guilty and worthless. You may begin to forget things or find it very difficult to concentrate, and you may even think about death or ending your own life. But just remember that there is always hope. So first of all, even small lifestyle changes can go a long way, and these lifestyle changes can be just as important as taking medication. So you can call or spend time with a friend, neighbor, or family member. Group activities are a really great way to engage yourself. Music, more activities outside or just outside in the environment. Exercise, continuing to spend time outdoors and in the sun can be a great way to increase your mood and also help with the depression. And if you think you're depressed, it's really just important to talk. Talk to anybody that you trust, but also talk to somebody who can provide you with some type of medical advice or other advice that you may not have yourself yet. So family doctor, pharmacist, home care worker, or nurses. So to diagnose depression, a doctor would be looking at certain indicators, such as a change in your normal mood, so your humor, affection, so your interests as well, and a decrease in socializing. And so how is depression treated? So the first one that pops up often in everybody's mind is medications, and there are very many numerous medications that can be used to treat depression, which is a good thing. But you can also go into therapy and seeing a counselor, someone you can talk to, engage in, and who can provide you with an objective outlook on what you've been feeling. And you can also do both. And so when will you start to feel better? So the important thing to remember is that it does take time for these treatment options to work, and it can be very frustrating because you want to get better and you are doing things to try and feel better. You're taking medication or you're going to see a counselor. But unfortunately, as you can see, for antidepressant medications, it can take up to 4 to 6 weeks for a medication to work. And with talk therapy or counseling, it can take up to 8 to 10 weeks to see a benefit. So it can be really hard for yourself and for the people around you if you think somebody has depression, because you want to get better, but it's so hard when you have to be patient with the therapy that you're doing. An important thing to remember as well is that not everybody responds to the first medication that they try, and it means that they have to try another button or another one. And so it's really hard, but it's important to stay patient and to keep trying and to not give up. So how do I decide which treatment to have? So the antidepressant medications are targeting basically your brain chemistry and your neurotransmitters. The purpose is to help you feel better and more able to do your everyday tasks, to reduce the symptoms of depression, so the low mood, the guilt, the fatigue, and to relieve anxiety. So which medication might you need? Well, the really awesome thing is that we have so many medications to choose from, and that talking with your doctor, another health professional, you can determine which one would be best for you. So there are two very common classes. SSRIs stand for a selective serotonin reuptake inhibitor. These work well to stop depression. They're relatively safe to use with very few side effects. The SNRIs stand for serotonin norepinephrine reuptake inhibitors. And these work well for people with pain in addition to the depression, because these are increasing levels of serotonin and norepinephrine. But there are numerous other classes of medications that we haven't talked about that can also be used to help with mood. So there's many things that we have available to use to help with depression. But non-drug options are just as important and can be utilized and combined with the drug options as well to really increase the efficacy and the benefit for everybody. So counseling sessions with a professional therapist, periodic and daily exercise helps to increase endorphins and can help your mood as well. Social outings and activities, making sure that you're trying to sleep and eat well will just be beneficial for your health and contribute to your mental health. And family events, engaging with people who love you and who you love. So often this happens, is quite common, that you have depression and another medical problem. It could be heart disease, diabetes, anything. The sky's the limit in this case. And so you should not have to feel depressed because you are unwell. It is normal to be sad sometimes when you're sick, when something happened in your life, but depression is serious and long lasting. So let somebody know if these feelings are not going away and if you're wondering if these symptoms could be depression. Another mood disturbance we wanted to talk about with the focus today is just the generalized anxiety disorder. So just like feeling sad is normal once in a while, feeling anxious is also normal once in a while. But being extremely anxious or worried for months is not normal. So signs of extreme anxiety can include constantly feeling on edge, having difficulty sleeping, it can affect your memory, and you may feel physical signs like tense, tired, and sore muscles. And so the important thing that we also want to summarize today is that you're not alone. There are so many resources in our community that we can utilize to help you cope emotionally with your medical conditions, with depression, with with whatever mental health issue that you might be feeling at the time. And many people care for you and for your well-being, people that you know, but also people that you don't even know that are available and want to help you if you need it. So a really important resource I wanted to talk about was the crisis line. It's a 24-hour crisis line in Alberta. It's toll-free, and it's important to note that it's completely confidential and anonymous. So sometimes it can be difficult to talk about our mental health and what's going on inside our brain where nobody else can see. And so this line you can access and call to just even get information about mental health, to ask questions, to talk about what you've been feeling or what somebody else that you know might have been going through. And it can also do crisis intervention as well if you might get a point where you do need emergent help. So the phone number is 1-877-303-2642. And I'll just repeat that. It's 1-877-303-2642. And it's a great line just for information and knowledge, but also it can be there as a method of intervention if needed as well.
Thank you, Patricia. That is great information. I want to open it up to the participants who've joined us this evening if they have any questions. So one coming in, what are some natural ways to help depression? How do I know if I need medication?
So I'll try answering that question, and then Dr. Cherniawsky will also jump in as well. So the natural ways to help depression, like the non-pharmacological, is what we call, or can be just as important as medication. And it can be really hard because you might be feeling depressed, you're unmotivated, you don't want to go outside. But just trying to engage yourself out in the environment with the sun, fresh air, people who care about you and who you care about, engaging with your family, with your friends. Exercise is actually really helpful because it increases your endorphins, which help to increase your mood as well. And so those are some, non-pharm remedies that can be used to treat depression and also to prevent depression, because those can also be important to just maintain a good mood, a good outlook. So how do you know if you need medication? I think the criteria for depression is, I believe the symptoms have to last for 2 weeks or longer. So not to say that, that's the absolute cutoff, and if your symptoms are 15 days, you should immediately go see your doctor. But it gives us kind of a timeline to say, should we be looking out more for the symptoms to go away, and a way for you to monitor, like, how long have I been feeling this way? And I guess it's up to you if you want to try medication. It's probably the most common method for treating depression, but it doesn't have to be the only method. And there are many medications that we can use and talk to you about with, different types of how to take it, side effects, stuff like that, that we could work with you to determine which one is best for you. Anything else, Dr. Cherniawsky?
All right. Well, I guess I just wanted to add that was a great answer, and the best sort of natural methods that we recommend are also that exercise, getting out in the sunlight. Some people, especially in Alberta, where the mood can have, the season can have a really big impact on people's mood. You can purchase some lights that are like a natural light, and sitting by those for 15 to 20 minutes a day, some people find that that's very helpful. Engaging in your community and volunteer service is another way that's very helpful to help lift your mood. Other ways, sorry, we're just getting told that I'm a little bit quiet here.
You can sit down.
Okay.
There we go.
All right. So the other thing that we do know is that medication alone actually is not the most effective way to treat depression. What we know from a review of the current evidence is that medication, along with lifestyle modifications like exercise or engagement in the community, and psychological therapy with a counselor is the best way to treat depression. And I really want to emphasize the importance of therapy as well. Their studies have shown that people who undergo psychological counseling and good quality therapy are more likely to prevent relapse in depression. So it's a very useful thing to pursue, not just treatment of depression in that in the immediate future, but also longer term.
Thank you. That's very, very good information. I had a couple, and again, please keep typing in questions as you have them. In terms of medications, Patricia too had mentioned the side effects. What are some of the common side effects from taking a medication that was prescribed?
Yeah, so the most common side effects that people have mostly relate to either nausea, vomiting, and some people might have diarrhea or constipation. That's the most common, and mostly those side effects will improve the longer someone takes the medication. So those are usually seen just in the first week or two if they're going to pop up, and they do improve with time. However, there are some other important side effects as well. With the SSRIs, which are the selective serotonin reuptake inhibitors, these can have an impact on patients who have heart disease, particularly abnormalities in the electricity of their heart. So it's important for your physician to know when prescribing those if you have any history of heart problems. Also, these medications, the SSRIs, can cause issues with sexual dysfunction as well. So men may experience erectile dysfunction and women may have a decrease in libido. That's another common side effect that people don't always talk about, but it's something important to know if you're starting on these medications and that becomes an issue. But largely, most of the side effects are at symptoms. The SNRIs, those medications work with norepinephrine. So that hormone is known on the street as adrenaline. So sometimes those medications can be very activating. So people who have anxiety as opposed to depression may not, or have an anxious component to their depression, may not benefit as much from those medications and might find them more distressing, or they may even worsen their anxiety. And as Patricia said, all of the medications work very different. They work differently, and they don't work the same in everybody. So sometimes just because one medication didn't work doesn't mean others may not. But it's important, as we said, also to pursue those lifestyle changes and perhaps psychological counseling as well.
Looks like we have another question. Wondering if depression can cause dementia or look similar with the symptoms.
Yeah, so depression does not cause dementia. However, the two can go hand in hand. So Patricia talked a little bit about how people who have illnesses can sometimes feel sad. And there's a concept called mourning of the well self. So sometimes when patients are living with dementia or living with heart disease, people may be more likely to have a sadness in the sense that they're mourning when they did not have these conditions, perhaps when they were younger or before whatever event happened that they developed these conditions. Now, that does not necessarily mean that someone is depressed. However, it can very quickly become or turn into depression. One of the important things to know about depression is that it can certainly have similar features to dementia, and namely, with depression, some people can have a lot of slowing of their cognition and feel that they're slowing not only in their physical movement, but also their ability to process things and process information. So sometimes patients who may have both depression and dementia can have a really quite a big improvement in their level of functioning and their ability to cope with their daily living when their depression is treated. That's something that's very common. So although depression does not cause dementia, you're very right. The symptoms can be similar, and they can go hand in hand. The treatment of depression can impact the outcome of somebody who's living with dementia.
Thank you. And again, please keep typing in questions. We have another question. Back to medications, talking that it takes some time for medications to see their effects. How much time until we know that that's not the medication for me? So how do we know when to try a new one?
Yeah, so generally we start off the medications slowly, and usually with prescribing medications for depression or anxiety, your doctor would see you every week or two in the first bit and increase the medication usually we start with a very small dose just to make sure you're able to tolerate that medication, not having that upset tummy or any other worrisome side effects. And then we would go up with the medication to what would be the therapeutic dose, or the dose that is helpful for most people. So the the general effect of these medications usually occurs within 4 to 6 weeks. So people who haven't had a response or feel they haven't had a change in their symptoms in 6 weeks or even 8 weeks, generally that means either one, that medication is not right for you, or two, that medication is not at a high enough dose. So those are the two options, but certainly if you're at a good treatment dose and at 6 or 8 weeks you're not seeing any effect, probably time to try something different.
And it looks like we have another question here, so please keep them coming. I heard that when a care partner is burning out, that they can end up sicker than the person living with dementia. Is this true?
Yeah, so I would say from my clinical experience, this certainly is true. And I mean, as with a lot of illnesses that may not have the same physical manifestations as something like heart disease or cancer, people who are suffering from care partner burnout can get very far along in that trajectory of burnout before they come to medical attention. And sometimes that means that people present when they're in crisis. So as we saw with the example with Marvin and Julia, let's say, for instance, Marvin had some health issues of his own, and he neglected to go to the doctor for himself to have a checkup at the expense of caring for his wife. It's not unlikely that he could have ran out of his medications, stopped taking them, or had some other new health issue popped up that ultimately made him sicker than Julia. So this emphasizes the importance of really being in tune with yourself and in tune with those around you and looking out for the signs of care partner burnout to prevent individuals from getting to that point of crisis. But I agree with the person asking the question here that certainly those who struggle from care partner burnout can end up sicker than those they are caring for.
And another question, how will I know if I'm just sad about the situation as my family member has dementia versus I'm depressed? Because we know people are care partners sometimes for many years. And so can I be sad about how do I tell the difference between that grief and that depression?
Yeah, so depression and care partner burnout are really can go hand in hand, and that's why we present them together like this, because they are so commonly linked. But with depression, it's that there is the medical definition of depression, but to put that in more terms that we can all understand together is, it's lasting more than 2 weeks. It's associated with the feelings of it's associated with the feeling of either I feel depressed and I can identify that, or a loss of interest in activities. So again, it's very similar to the care partner burnout of I am feeling like I don't want to go out and go to coffee like I used to. I don't want to see my friends like I used to. I like to go for walks and I don't want to do that. I used to knit and I haven't knit anything in the past 2 months because I just can't bring myself to do it. Additionally, there's other changes, physical changes, changes in weight, changes in appetite, changes in sleep, either sleeping all the time or never being able to sleep, changes in your physical feeling like you're slowed in your movement, or having difficulty physically doing what you used to before, just from that tiredness and that sadness, feeling of guilt, feeling guilty for everything and that everything is your fault when it clearly is not. Those are largely the symptoms that help distinguish sadness from depression. Depression has that unlifting nature and those associated physical and other psychological manifestations.
We have another question. Where can I seek help if I feel like I have care partner burnout?
So I would say the first step is probably talking to people around you, either a close friend or a relative, and also seeking help from either organizations in your community or even medical professionals like your family physician. The resources we have listed, including the community care access, is really great for putting things in place at home to help prevent or help with care partner burnout, but also the crisis line, that line 1-877-303-2642 is a great phone number to call that specifically deals with mental health. So they can help talk you through what you're feeling and also direct you to who may best be able to serve your needs right now with what you need right now, whether that's your family doctor or a therapist or some other organization. So I would highly recommend their services as well as seeing any sort of health professional in your community that you're linked up with.
Thank you. Looks like we have another question coming in. We'll stay on as people have questions coming in. So just to let people know that all of the resources discussed tonight will be posted on the Assant Cafe for people to access and check under the discussion session. So for anyone who is looking for those resources that Dr. Cherniawsky and Patricia too have listed in their PowerPoints, you will be able to access that information on the Assant Cafe. Is there any other questions? I'll leave it open for a couple more seconds if anyone has any questions they'd like to type in. Okay, looks like no more questions. So I just want to thank you very much, Dr. Cherniawsky and Patricia, on behalf of the Alzheimer's Society and Northwest Territories. We really truly would like to thank you for both coming out and thank you for your time tonight. If anybody does have any questions or you're looking for support, please contact your local Alzheimer's Society. Thanks again for everyone for attending the webinar this evening, and everyone have a great evening.